Welcome to this edition of Clinical Clips, an accredited continuing education activity. This brief 5-minute expert video will spotlight the daily hot topics from the conference.
Hi, this is Dr. Doug Dietrich reporting to you from Vienna on the 50th Easl conference. Today we're going to talk about some presently approved drugs. First, the AbbVie regimen was presented in the Japanese trial for genotype 1b only, 95% overall SVR and 91% in cirrhotics, which was actually lower than in the US, kind of surprising. I expected it to be higher. Paul Pakros presented the AbbVie 3D regimen in patients with renal failure, GFR of less than 30. The Ruby 1 trial, it's called. Patients with genotype 1b did not receive ribavirin, but patients 1a did, and they generally got ribavirin about 4 hours before dialysis. The numbers are not in yet overall, but 85% of the patients were Black or Hispanic, reflecting renal failure in Hep C, and 11 of 11 had SVR4 so far. So it looks good so far in patients with renal failure. In terms of sofosbuvir liposphere, we saw one study on genotypes 4 and 5 with 93 and 95% SVR rates respectively. Excellent numbers there. And we saw Graham Foster present Boson, a study of genotypes 2 and 3 in cirrhotics who had previously failed interferon. Genotype 2, it didn't really make a difference actually whether you used 16 weeks of sofosbuvir ribavirin, 24 weeks of sofosbuvir ribavirin, or PEG-SOF ribavirin. The number was about 88% SVR. For genotype 3, though, it was very clear that 12 weeks of SOF-PEG-RIBA yielded a 93% SVR rate. So at least for the moment, there's a good solution for genotype 3 patients who are cirrhotic. SOF-PEG-RIBA, 95% and 88% in the cirrhotic patients. For drugs that are approved in Europe but not in the US, declatosphere had several studies, one in non-transplant patients at the ANRS, the French study called Hepathere, in F3, F4 patients, showed actually a very good SVR rate, and the recommendation was for 12 weeks of declatosphere sofosbuvir without ribavirin, without cirrhosis, that is F3, and patients who had cirrhosis 12 weeks with ribavirin, SVR rates were nearly 100% in this group. There were several studies pre and post-transplant using SOF, declatosphere, and ribavirin, one from the French and one Ally 1 presented by Fred Pourdad. The one in Ally 1, Fred presented, the overall numbers were about 83% in cirrhotics, 94% in the post-transplant, but the big difference is they were lower numbers because the child's PUC patients showed an SVR rate of about 56%. The French numbers were better, and they reflected what Ally 1 did for patients who did not have cirrhosis, that is 96% and 95%. So this looks like a promising regimen expected to be approved in the US in the summer of 2015. Thank you for listening. This is Dr. Doug Dietrich signing off from Vienna, the 50th Easl. The third day, tomorrow, we will talk about the best of the posters.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with today's clinical clip.